Hello viewers, once again I am here to discuss a very important topic of the day. Myself Dr. Surajit Santra, consultant pediatrician and neonatologist from Bhagirathi Neotia Hospital, Rawdon Street. Since last winter, the kids, especially school-going children, are suffering a lot. They are suffering from recurrent fever, cough and cold, diarrhea and whatnot. And this is causing enormous anxiety among the family members, among the parents, because of their suffering as well as for their school absence. I thought it will be a very helpful for all the parents if I can discuss little about this topic, why this is happening and what is the remedy. Now, for this last 2 months, we are getting ample number of kids suffering from variety of diseases, infections. Most common symptoms of all these is fever. It is really causing anxiety amongst every family members. This fever is peaking very high, sometimes in the range of 103 to 104 degree Fahrenheit, and causing very much distress in the child. Sometimes it is persisting 3 to 4, sometimes 7 days. The next cause of distress is cough. This cough is bothering the children like anything. They are coughing throughout the day and it is increasing more, especially during night times, which is hampering their sleep. Along with the cough, they are also having blocked nose, running nose and sneezing. Other than this cough and cold, we are finding the kids suffering from varieties of skin rashes. They are having redness of eyes, sticky eyes, maybe in the initial or later part of the fever. Sometimes we are getting diarrhea. The children are suffering a lot. They are passing loose stools and vomiting, and sometimes they are landing up with dehydration, which is requiring even hospitalization. So these are more or less the clinical symptoms what the child is being suffering from. Now, what is the home remedy when your kid is getting infected with all these viral infections? First of all, limit child going to outdoor to the school on the earliest sign of these viral infections. Don't let the child go to outdoor or school. Next, try to cover the child's face with mask, especially if the child is grown up. Let the child have lot of fluids. This is very important. Fluids in the form of water, ORS, fruit juices, soups, like that, so that there is no dehydration in the child and their urine is adequate. For the younger kids, very small kids, you should allow breastfeeding from the mother as much as practical. Now, use proper antipyretics in the form of paracetamol drops or syrups to keep the child's temperature down. Keep the room airy and properly hydrated. The temperature of the room should be ambient. It should not be very hot or very cold. Use some nasal drops, nasal saline drops, so that the child's airways are free and they can breathe easily. These are more or less the home care of the child. Now, when will you go for a medical consultations to the pediatrician? There are few signs we as a parent should keep in your mind so that you can attend to the doctor's clinic. First is the breathing problems. The respiration of a child varies as per the age. For the newborn, it's around 40 to 60 per minute. Now from 6 months to 1 year, it's 30 to 40, and 1 year onwards is 25 to 35 per minute. So any breathing rate more than these and the chest wall moving very fast is taken as breathing problems, or we call it respiratory distress. So if you feel your child is breathing very fast, then definitely you should consult your doctor. Next is cough. If the cough is too hacking, it is becoming too unbearable for the child and it is persisting for long, then you should think whether my child is having some breathing problems or whether my child is getting sort of chest infection or not. So that is another matter of concern when you should definitely ask your doctor. Third is the hydration status. If your child is passing frequent loose motions or having persistent vomiting, then you should assess your child by their urine. If the child's urine is going down, then you should have an idea in your mind whether my child is developing dehydration or not. So assess the child's urine and also assess whether my child is having proper liquids orally or not, whether the child is feeding adequately or not. So these 4-5 are the signs, we call it red flag signs, where you should be very conscious that yes, you should take your child to a doctor's clinic or to the nearest hospitals. For your kind informations, for the last 2 months, lot of virals are hovering in the environment. We are doing through a nasal swab in the kids to just understand the pathogen, and we are finding adenovirus first and foremost, followed by respiratory syncytial virus, we call it RSV. We are getting influenza virus, para-influenza virus, and also we got some pertussis type of bacteria, and our new strain of COVID also we got in few babies which was not detected by RT-PCR. So you can understand there is a bizarre mixture of pathogens which are affecting the kids because their airway immunity has gone down. And lastly, what is the protection? What you will do to protect your child? So the first thing is that if any of your family members is affected by any viral infections, don't let the child get in touch with that affected family member. If your child is grown up, please let the child wear mask while going to school. That is number 2. Number 3 is it is advisable not to take the child outside any congested places like shopping areas and malls where there is people crowded. So the child should not face the strangers too much. And lastly, let the child make the habit of frequent hand washing, hand sanitization, so that they don't touch the infected materials too frequently. If we can adhere to all these strict guidelines, I hope our kids will be safe and healthy. Hope this much of information will help you in long run. Thank you. Thanks for your patience here.